and modernizing this vital program, we are honoring the commitments of Medicare to all our seniors.
That's a lie. The Medicare Modernization Act is about privatizing Medicare and clamping down on future expenses. Business and government are desperate to contain the health care costs of the 70 million new seniors who will retire in the next 10 years. So the law aims to stop having a Medicare that pays for whatever health care we need. Instead, they want Medicare to hand out monthly checks, and we have to make that check cover our needs. Already, CMS is beginning a plan to reduce payments to Medicare doctors by 40% by 2009. This will drive doctors out of Medicare or force them to reduce office visits.
In addition, the Medicare Modernization Act puts the entire Medicare program in danger of going bankrupt and disappearing. This attack on Medicare is part of a broader attack on seniors by business and government. Other examples are privatizing Social Security, phasing out public and private retirement pensions, and huge cuts in Medicaid, Medi-Cal that pays for so much of long-term care and nursing home costs. As seniors and disabled people, we have a big, big fight ahead of us.
We're the San Francisco Gray Panthers. Privatize Medicare?
No way!
Scrap Medicare Part D and the whole Medicare Modernization Act. We want comprehensive universal health care for all.
Why are we here today? We would like to talk with you about what the Medicare Modernization Act is, what is its significance, what we can do to stop it, and what would be a real solution. Here's what the Medicare Modernization Act does. It creates a drug plan using private companies.
It forces people to buy medicines from private companies at whatever prices the companies want to charge.
It is riddled with complexity, confusion, coverage gaps, and restrictive drug lists.
It disrupts our health care, threatens us with bankruptcy, and endangers our lives.
The poor and the sick, the people most needing help, are now paying more than before.
And drug companies' already obscene profits are growing as never before.
What else does the Medicare Modernization Act do? It begins the privatization of medical care for seniors.
Medicare would no longer pay for seniors' health care. Instead, Medicare would give them some money and let them shop for a plan which they hope would cover their needs, either traditional Medicare or an HMO. Medicare would have to compete with HMOs on unfair terms that would make it end up with the sickest, most expensive patients that HMOs don't want or can't care for. Medicare's premiums will rise to cover those sicker patients, and Medicare patients will have to pay the premium increase out of their own pockets. This will force even more healthy patients out of Medicare and into HMOs. Seniors' health care will be further fragmented by a premium surcharge for higher income recipients, making more incentive for them to drop Medicare and making Medicare into a vulnerable welfare program. Traditional Medicare will go into a death spiral. Sicker and sicker patients, higher and higher premiums, fewer and fewer participants, and less funding. Medicare could go bankrupt and disappear.
And if that wasn't enough, the Medicare Modernization Act also threatens to bankrupt Medicare by limiting its future federal funding, just when 70 million new people will be reaching Medicare age. This process is already starting. What else does the Medicare Modernization Act do?
It creates health savings accounts. Health savings accounts are essentially tax cuts for the rich, because they can deposit it into them tax-free and withdraw tax-free for medical purposes. But most of us don't have the disposable income that would let us benefit from this provision.
Health savings accounts are also coupled with a new kind of stripped-down health insurance, where we pay thousands of dollars out of our own pockets before insurance payments kick in. These high-deductible policies threaten the existence of comprehensive health insurance as we know it. So summarizing, here's what the Medicare Modernization Act does. 1. It creates a privately run prescription drug program that deprives seniors of real drug coverage and enriches the drug companies. 2. It begins privatizing seniors' health care, leaving only sick and poor seniors in Medicare paying higher premiums. It puts Medicare itself in financial danger, and it will convert Medicare into a politically vulnerable welfare program. 3. It limits federal funding to Medicare just when its need will be the greatest. And 4. It creates health savings accounts, tax breaks for the rich, and a new form of sham health insurance. So what do we have to do? We need to demand the Medicare Modernization Act be repealed and replaced by a new plan. A plan that gives seniors and disabled all their drugs at low cost in a simple Medicare-run program with prices negotiated by Medicare to reduce drug company profits. A plan that keeps all seniors and disabled in the same Medicare-run healthcare program with equal benefits and costs regardless of their health or income. A plan that assures Medicare's future financial viability, and a plan that enables Medicare's benefits to be expanded and extended to everyone. Medicare for all.
We need to have Medicare for all. We need an expanded Medicare covering everyone, regardless of age, health, or income. Full coverage, including drugs, for everyone. Equal benefits and costs for everyone. Nobody excluded for pre-existing conditions or no job. No insurance companies taking 20 to 30%. No chaotic billing systems or blizzards of paperwork. Centralized medical records to reduce medical mistakes. Medicare for all. Equal, comprehensive, low-cost health care for all. 3 plans for Medicare for all are in the works now. 2 national plans. H.R. 676, the U.S. National Health Insurance Act, by Representative John Conyers and 72 co-sponsors, and S. 1218 and H. 2034, recently introduced by Senator Edward Kennedy and Representative John Dingell, which would allow early enrollment into Medicare. And 1 state plan, SB 840 and SB 1014, the California Health Insurance Reliability Act, by State Senator Sheila Kuehl and 39 co-authors. Last year, it passed the State Senate and Assembly, but the governor vetoed it. This year, as the health crisis deepens, it is back in the legislature.
Can we defeat the Medicare Modernization Act? Can we win Medicare for all?
This is a tall order, but remember we have won before. In 2005, Bush said privatizing Social Security was his top priority, but we stopped it cold. Now we will have to repeat that fight to save both Medicare and Social Security. Here are the Gray Panthers in San Francisco, joining with others across the country to expose the scam of privatizing Social Security. Remember, Medicare was won in 1965, a time of strong activism and civil rights, peace, and our right to health care. Unions and other groups sponsored huge demonstrations and rallies for Medicare. Here is a picture from the 60s of a demonstration by furniture workers in solidarity with the Congress of Senior Citizens. We can continue in that same spirit of activism today. We can have rallies and demonstrations. We held many rallies and demonstrations at Dianne Feinstein's office. Senator Feinstein supported the Medicare Modernization Act, and we gave her a lot of heat for it. This is an action in San Francisco at the Western Regional Office of CMS, which administers Medicare. Our outlook of attacking the entire Medicare Modernization Act helped give the action a stronger tone. 40 of us in California Alliance for Retired Americans and Gray Panthers went into a conference CMS hoped would make us accept their program. Boy, were they surprised. We can rally with health workers. Here are the Gray Panthers demonstrating at the American Pharmacists Association National Convention in San Francisco. During the chaotic transition into Medicare Part D, many pharmacists dispensed prescriptions without reimbursement to ensure that their patients got their needed medicines. We saluted those dedicated pharmacists and called on their association to demand repeal of Part D. The association refused our demand, but many pharmacists thanked us, agreed that Part D is a failure, and said the association should have stood up for its members. These same problems still repeat every month as Medi-Cal patients reach the age of 65, are forced into Medicare Part D, and either fall through the cracks or cannot afford the co-payments they now must pay. We can sign petitions or postcards to repeal the MMA. This was an action we held at Nancy Pelosi's office on May 15, 2006. The last day people could sign up onto a Medicare Part D drug plan without a lifetime penalty. We called it Mediscare Part D Day. The California Alliance for Retired Americans had collected 500 sheets of signatures representing 15,000 people calling for the repeal and replacement of the MMA. We presented them to Pelosi's office. We are now collecting postcards on this, and you can pick some up at the meeting today. We can rally with unions. This is a rally of the California Alliance for Retired Americans, and workers here are from the Communication Workers of America, CWA. And finally, we can ally with community groups.
So where does all this put us? And where do we go from here? We invite you to join with us in the fight to save Medicare. Here's what you can do. 1. Join with Gray Panthers or the California Alliance for Retired Americans in your area. Contact information is available at today's meeting. 2. Fill out the postcards to Senators Feinstein and Boxer and to your representative, demanding protection of Medicare and Social Security. 3. If you found this talk useful, let us give it to your club or church or living group. 4. Tell your friends and family about the MMA and about the state and national Medicare for All bills. 5. Write or call your representatives about the MMA and about the state and national Medicare for All bills.
We're the San Francisco Gray Panthers. Privatize Medicare?
No way!
Thank you for inviting us.